then we'll see what we can say. And this is just two people here, so feel free to interrupt me at any point in time, and then we'll get through this. So good afternoon, everyone. I'm Dr. David Ajibade. I'll be talking to you about brain health and basically what you need to do to keep control of your brain health. But I'll be pointing out a lot of things that maybe your doctor has not spoken to you about, and things that probably you can practicalize, you can put into practice on a daily basis to start taking control of your brain health. What I've noticed, I've been speaking throughout the city of Baltimore and the state, and everywhere I go, whether it's very rich environments, whether prestigious, exclusive club settings, and I've been spoken there. I've spoken in, shall we say, very low-income areas as well. I did a lot with the city of Baltimore, the Department of Aging. What I found out is that regardless, almost everybody is ignorant about brain health. And when you point certain things out, they're like, oh wow, I didn't know that. And some people are actually doing the opposite of what it takes to have good brain health. And they think they're doing the right things. So hopefully we'll be able to set you on the right track. And like I said, please feel free to, there's just two of you, so you can always interrupt and clarify. It will not hurt my feelings at all. So let me give you a quick background. I'm not from here, as you probably can tell. I am a physician. I run a practice in Nigeria. I actually have a foundation, an NGO, a non-for-profit organization, which caters to kids with brain disorders and sickle cell disease. Nigeria has the most number of black people on the planet. So sickle cell disease is primarily a black person's problem. So we have the most number of cases of sickle cell disease, and it's a deadly blood disorder that kills most people before the age of 5, and we have a bunch of them dying. So we figured out a way to address this. But the environment back in Nigeria and most third world countries is that for brain disorders, we don't have any, for most people who have brain disorders, especially the low-income people, they don't have access to great healthcare, they don't have access to insurance, they don't have access to lab tests. Many of them are just taking their children to government hospitals for physical therapy, and that doesn't help much, because once there's brain damage, significant brain damage, that brain needs to be restored. So we set up a foundation that was specifically catered to these kids. Now, this is the background for what I'm going to be talking about. I know we're not here to talk about kids, but this set up the foundation for me to do what we're doing with dementia, okay? And so these were the constraints. We just didn't know what to do. I mean, there were no, shall we say, protocols to treat these cases, so we had to figure them out. And we also had to make sure that whatever we figured out worked quickly and was simple, and it could be reproduced, and most importantly, it had to be safe. Because we're dealing with kids who were like 6 months old and above. And these kids had, like I said, severe brain disorder. So we had to figure it out. And I had to sit down every week. So in addition to my busy practice, I would set up a day aside to take care of these kids every single week. And I gotta tell you, I mean, even though they were not paying us any money, and looking back now, I feel that we should have been the ones paying them, because we learned so much. And a lot of that learning, I would fly back and forth from Nigeria to the US to learn from experts who I maybe had seen online or YouTube, and maybe they had come up with this really ingenious, innovative approach to brain health. When I found out about them, I would contact them, hop on a plane, and basically go and sit at their feet and learn from them, or attend their conferences. And many of them were very generous to me. They actually let me attend their conferences at a discounted rate or even free of charge, because they knew what I was doing. So that set up the foundation for what we were doing. Quick story, one of the patients that we dealt with, really what set us up and showed me the power of learning of how to deal with brain disorders using nutrients was this kid in front of you. She was, when she came to my clinic, she was 2 years old. She was insulin-dependent diabetic, so blood sugar problems. And the nurse made a major mistake. she gave her 100 times the dose of insulin that she needed. Now think about that, 100 times, not just twice, 100 times. Fried her brain. I mean, when she came in, she was like stiff as a board. She didn't die, but her brain was pretty much, like I said, in serious trouble. So she was very stiff. In fact, her head was like really pulled backwards. And in severe pain, always crying. The government had tried to help. They had sent her to hospitals in Dubai and the UK, nothing. So when she came in, I didn't know what to do either, quite frankly. But I did know that omega-3 fatty acids, everybody heard of that. Omega-3 fatty acids are important for brain function. In fact, 60% of your brain's mass is composed of fats, and about 50% of that fat is omega-3s. So I knew we couldn't go wrong with omega-3s. I gave her a bottle of omega-3 free of charge, and I told her to take a teaspoon 3 times a day. She thought I said a tablespoon 3 times a day. Are we seeing a pattern here? Well, that was what did the trick. If it had been a teaspoon, she probably would not have come back to me. But with a tablespoon was the dose that was needed to keep that brain back into gear. And she brought the kid back, and that stiffness had relaxed tremendously. Within 2 weeks. And the word her mom used was magic. She couldn't believe it. And so that kind of like got me thinking. I'm like, really? These were things that we were trained in medical school were impossible to treat. So it got me thinking, if one nutrient could do this, maybe there were others that could do that. And like I said, that's what's got me on research, and I started flying back and forth from Nigeria to the US to find out other things that could help. And essentially we basically started treating all kinds of brain disorders, from autism to epilepsies, to Down syndrome, and eventually we started having adults coming to our center with things like Parkinson's, strokes, dementia, and so on. So we are doing the entire gamut of things. And in the process, we have won several awards for the work that we've done. And we have a lot of testimonials on our website, video testimonials of people who have been helped and supported by our work. So it's been a very, very great, gratifying journey for me. But it's not about me or the work we've done. What I'm particularly concerned about is shall we say, it's almost like an epidemic of dementia we're seeing. Almost everybody I meet has some story of dementia. Their father, their mother, their grandparents, whatever it is. Almost everybody. That's why, June, I'm really surprised, quite frankly. Because everybody I know tells me a story.
But you know someone too.
Yes. Yes. So anyway, and these people go through a lot of, the caregivers now, the loved ones go through a lot of emotional turmoil, regrets, loss, sense of loss and grief. As a matter of fact, I don't know if you know this, but 42% or more of caregivers, loved ones of people who have dementia, end up dying before their loved one dies. In other words, the dementia person lives longer than the person who's taking care of them because of all the stress and the things they go through. So it's a big problem, and the burden falls mainly on women. The vast majority of caregivers are women. In fact, about 30% of them, or 30% of people with dementia is their daughters that are taking care of them. And we know women have twice as high a rate of dementia as men do. So it's a huge burden upon women. So it really makes me feel we need to do something. And what I'm saying is not that much is really being done. And this is not an indictment, but it's just the truth. Everybody's waiting for that super duper drug that's going to come, it's going to be approved, that's going to take all our cares, all our burdens away and solve the whole dementia problem. And I'm here to tell you that that is just not true.
One drug is not going to do the trick. It needs a combination of targeted approaches that deal not just with the brain, but also with other organs as well. Because the brain depends on influences from several different systems, not just one. So hopefully we'll be able to get into that as we go along. My hope is that you can have hope and probably a sense of direction
About what to do, or maybe you can share with your loved ones about what they need to do beginning today to take care of their brain health. All right? Because you need a lot of hope. I mean, dementia is not just a psychological thing. There's actual loss of brain cells, brain tissue, by about 30%. So on the right side, you have a normal brain. This is 30. Dementia brain is full-blown dementia brain. It's 30% less. That is a lot of brain tissue, a lot. And is it possible to reverse that? Yes, but it takes a lot too. It's better we just focus on maintaining what we have. What do you think? It's better we just maintain.
Ask, how long before you actually show real signs of dementia that your brain has been transforming? How long does it take?
Good question. Some say in your 40s, the damage begins in your 40s. Some say even before that. Some say in your 20s. That it's a decades-long progression.
So it's individual. It's like an individual thing, or you have certain. Okay, let's look at decrease in nutrients or whatever. I don't know how it develops, how it starts.
We'll get to it. It's a combination of things. Either attacks, things that damage the brain, and then not having enough of the things or nutrients and other things, not just nutrients, that help to support and strengthen the brain. You need. For someone to come down with dementia, it's a combination of usually 2 or 3 things. I will get to it. All right? So just to warn you really quickly, I'm going to be saying things that maybe your doctor has not heard. But this is out. You're not going to hear some of these things in the waiting room, in the doctor's consultation room. And some may not. Some of the things I will say you may not like at all. And I usually have to warn people about this. What I see, Mike, is that it's usually in these prestigious, exclusive clubs I go to speak at, and they get upset with me because, they have the Johns Hopkins world-renowned neurologist who's telling them something entirely different. So who am I, I'm from a, what country, third world country, so what do I know, right, compared to the neurologists? But here's the thing, I just kind of explained to you that I had to learn on the street, so to speak, of what actually works. The neurologist has to work within specific confines, cannot go outside that box. There's a box that has been set up for them. They cannot go outside the box. They cannot, quote unquote, experiment to see, does this work or does that work? Nobody can do it. They can't do that. Now, I did that for decades. So that's the advantage I have. I can do a lot of other things that most neurologists have not thought about using. And most neurologists don't think about nutrition. They only think in terms of medications, which is, in my opinion, is a big problem. But the brain, in many cases, is starved of the nutrients it needs to work. And so we're talking about that a little bit. Okay, I guess we have to define what dementia is. You mentioned it. You of course know what dementia is because you experienced it. But essentially, when it comes to Alzheimer's disease specifically, Alzheimer's disease is the brain saying enough. And the brain is actually the one now shrinking and switching itself off. I'll say it again. Alzheimer's disease, for lack of a better word, is the brain saying enough and switching into hibernation mode, or some people say self-suicide switch has been flipped on. And that is as a result of the decades-long damage to it by several different factors. But when it becomes Alzheimer's disease that we know, when that downhill slide really begins, it's actually the brain shutting itself down. Any questions? Yes.
I'm guessing you're gonna get to it, but just ways to mitigate that or slow it down or prevent that
Yeah.
from happening. You were talking about what the brain is primarily composed of, most of the fatty acids. So like are there certain behaviors, other than just, good gut health or, food we eat, air we breathe?
Yeah.
Is there anything in the home, like air filter, like what are all the things we could be doing to hedge our bets?
Good question. Yeah, so like I said, it's the combination of toxins or insults that are getting into our brains or that are affecting our brains, and the combination of weaker protections, whether it's external protections or internal protections. There's some things that we put on ourselves unwittingly. Some people live in mold-infested homes, and those mold produce toxins that can damage their brain. They have no idea about it. Some people live in very air polluted locations. They probably don't realize it. So those are environmental factors. Also lifestyle factors play a role as well. So we'll get to it. So obviously it's more likely to affect elderly people as opposed to younger people. Although I'm beginning to hear younger and younger people are coming down with it. Like someone was telling me about a 40-year-old who came to their center and he has the full-blown dementia. And that's because of the time factor. It takes decades for it to eventually build to become what is known as Alzheimer's disease and dementia. So let's just look at what happens. I have this quick diagram here, basically showing how the brain gets weaker as it gets along. But the brain is developing, obviously it develops before birth from in the mother's womb. 25 is when the brain is fully developed, including the frontal lobe. All right, so you're smiling, Mike.
Well,
Some
for
people
women probably, but not for men.
It may take a little longer than that. But let us agree it's 25. You can think about it. So it's all downhill from there, right? Right, June? All right, midlife is kind of like the tipping point. This is when the protections, the defenses, this is when you become more subject or more vulnerable to chronic disease, and the brain does not have the strength and the protections it used to enjoy at a lesser age. Menopause, one of the reasons why women have it twice as bad is because of the drop in estrogen and progesterone around the time of menopause. Estrogen, most people don't realize, is probably one of the greatest protectors of the brain. And in some women, that drop could be as much as 30%. Once you lose your protection as a woman, the brain, it becomes, as you can tell, as you can figure out, more prone to damage if there is damage. And again, we'll get to what kind of damage it is. At 65 is when dementia is most expected, 65 and above. So this is like the cutoff mark. You've heard about early onset dementia. Okay, so early onset is before 65. Late onset or regular dementia is after 65. And by 80, 85, 1 in 2 people, adults, will have dementia. All right?
So how long has this information been out there? So why, it seems like they would have started, it's like they did the blood pressure, they would have started testing or asking about dementia or having that being part of the physical exam, but doctors should have been talking about that. If it's been known for a long time that will happen, why isn't it enough? Just like they talk so much about blood pressure.
Right.
Haven't they, we're talking about dementia just as much, knowing that it's detrimental to, the family and so forth. It should have been, at least an article mentioned.
That's a great question.
Go as blood pressure.
It's a great question.
Blood pressure.
Yeah. Well, although blood pressure is important too.
And blood pressure.
It's one of the risk factors for dementia as well. Yeah, I mean, that's a great question you're asking, but I wish I could tell you what the truth is. I wish I could give you an answer for that.
It should be.
It sounds, looks
It should
pretty
have been a dementia doctor. Well, you go to your primary care, or you go to the dementia doctor just to get a baseline to see.
Exactly.
And see, they may catch something
Exactly.
earlier.
Absolutely. That's my point exactly. In my opinion, everybody should be able to have a course on dementia. Even if you're a pediatrician or OB/GYN, I don't care. Everybody should have a course on dementia so they can know and have a high index of suspicion and then refer you to the right doctors.
You mentioned having a baseline. So my father succumbed to Alzheimer's and early onset dementia, and so I went. Last year I went to my primary care physician and I told him your family history, and I said I would like to get a brain scan just to have a baseline. And the doctor that I asked said, yeah, with your insurance, that's not enough of a reason to. So that really bothered me. So I went. Months passed by, and then again, sometime maybe let's say six months ago, went to the same doctor's office, but maybe saw the neurologist that I see right in Baltimore. I told him the same thing, and he said, well, "Let me ask you this: you having any memory issues, forgetfulness?" I'm like, "Yeah, sometimes." And he immediately said, "Okay, we're going to set you up." Like he just needed to hear anything for it to have a reason, and I knew what he was doing. He was going to make sure whatever he was going to get the right answer for, and it was an honest answer. And I went and I got. I'm 52 right now, so I figure that's a good age. Hopefully everything's still okay, but if not, at least I have a baseline. So when I'm 62, there's something to compare it to instead of saying we don't know how long your brain was like this.
Exactly.
Fortunately, everything was okay. So anything that's wrong with me, I was born this way. I can deal with it. But like, the fact that just wanting a baseline wasn't reason enough, that should be reason enough to have.
It should be.
Like it should be a preventative.
It should be. Yeah.
thing.
I totally agree.
So how much progress has it? Not much, right?
Listen, I was talking about vitamin D.
But
They want to do a test for me, just kind of like do just a regular blood test. They did not include vitamin D, and black people are most deficient in vitamin D. So I asked for it, and they were like, "Yeah, no, we don't routinely do it, and no, we can't do it."
is this dementia month or something like that?
Yeah, yes, I believe it is. I think it's mental health and dementia month. Alzheimer's month is this month. Yeah.
Because I know the church over there had last Saturday a memory loss, something like what you were going to.
Okay.
I missed that.
Okay.
And then tomorrow night I'm going.
Yeah, but what are they going to do about it? They're not going to say what to do to reverse it. That's my challenge. They're probably going to provide support services, hold your hand and say, we feel your pain. But in terms of doing something specific to reverse memory loss.
But again, I think that one, it did have to be. But I went to one last week. It's not that many people.
Yeah. And then another thing, people don't want to be associated with it. They want to live in denial and not really want to deal with it. Mike, I need a favor from you. You should take pictures, and you get one of your staff and just take a picture from the back.
Okay.
If you don't mind using your phone now.
No, not at all.
All right, thank you. All right. So we already have. No, I need you to be in the picture. Can you call someone to do that? Yeah. I need you in the picture. Thank you. So you were trying to remember. We were trying to remember the different kinds of dementia. So there's Alzheimer's, vascular, temporal. His dad actually died of frontotemporal dementia.
So Alzheimer's is more prominent than the others.
About 60 to 70. I would say 70 to 80% have it. So most times when people are talking about dementia, they're really referring to Alzheimer's disease. It's a big bad wolf that's out there. Okay?
Well, can I come on? Oh, we get ready to switch that up. I'll just come up and look at it.
We come in. Okay, one thing.
Well, I guess.
I'm gonna sit.
There's a lot of Parkinson's disease
Just,
too.
yeah, I mean.
I heard that. Yeah, I heard that. Yeah.
Okay, so you wanna sit in our seats while you present?
Yes.
He's gonna take a picture.
So ma'am, no, you sit where you want to sit.
Oh.
Then you can just come from the back.
Oh, take a picture from the back.
Oh, and if you're okay with it taking from the front as well, that'd be great as well. All right. So yeah, take a couple from the back and include them in the picture, please. And then you can take some from the front as well, if you guys are okay with that. Okay. So let's move on to the next one. So can you get me in the picture as well? Thank you. Then we can get everybody. Can get everybody.
Let me just get you real quick.
Okay. All right. So like I said before, it's really the brain saying enough. All right. And then I have this diagram here to show that it's as a result of the accumulated insults. That's what the red flashy signs are. Damaging the brain, making it shrink from this size to this size. And not enough of the good stuff to protect it. So to address this and to prevent, if there's something going on, but to prevent anything from going on, this dementia is thank you sir, you gotta increase this and reduce that. Does that make sense? That's really what this whole keeping your bubbles is about. Finding out what will strengthen or help your brain and embracing it, and then finding out what are the things that are harming your brain, and then eschewing it, avoiding it, mitigating against it, or finding a way to reduce the damage on this side. And in many cases, people are different. So black people we have higher risk factors in certain areas. White people have higher risk factors in other areas. Women have higher risk factors, like I said, especially if you pass menopause. Men have other risk factors, probably more to do with their lifestyles, risk-taking activities, more prone to head injuries than women are, and so on and so forth. We can kind of do dumb things, right? Men do more than women do. Women are a lot more careful. But so really, if we're going to address the dementia epidemic, and I got to tell you, there's been serious uptick since COVID. COVID has really stirred things up. A lot more cases are being diagnosed these days than they were before 2020. A lot more cases. So if we're going to get a hold of it, a handle on it, the solution is to educate people, lay people, as well as healthcare professionals. Like you said, you're very astute of you, by the way, to point that out. Doctors need to know so that they can refer and start acting as quickly as possible. All right. Have I shown? Yeah, we've shown this already. So the question is, okay, let me point out this. As your brain gets older, one of the things that stands out the most is that the energy levels reduce as we go along. That makes sense, right? Physically, the energy goes down.
Oh, I was getting ready to say that it wasn't until just recently you hear how important sleep is.
Yeah.
I mean, it was just it's recent. I mean, a couple of years ago, they doubling down on sleep.
Yep.
And I didn't hear that much before.
Yep.
But now,
Very,
sleep,
very,
you
very
have
important.
to have your sleep.
Yep.
And that's another risk factor for me.
Very, very important. Yeah, and women have a greater problem with sleep than men do, by the way. So energy levels is one thing that we can point to us. We know for sure that it declines with age. So in your 20s, you've got 100%, and then as you get older and older and older, it kind of like drops. Actually, you kind of lose like 15 to 20% of your energy levels by the time you get to be 80. But anyway, you understand that picture, right? So The reason I'm pointing this out is that as brain energy levels drop, you get more, the risk for dementia gets higher and higher. And you know what? I'm going to get to that picture very soon. But I'm going to show you a picture that shows the whole network effect. So the brain is, if you think about the brain, you have some IT background? No, okay, computer, IT. The brain is like a network of several computers all connected, right? It takes a lot of energy to maintain this network. So once energy levels begin to get lower and lower, now in dementia, they show that this decline is a lot steeper. Remember we said it, sometimes some say in your 20s, some say in your 30s. The people who eventually get dementia in their 60s, 70s and above are those, they can trace it back to a steeper decline in energy levels. Now, there are ways to check the energy levels, but they cost a lot of money. That you can't get that on a regular MRI scan or PET scan. There's a special device they use to do that. Now, there are surrogate ways we can do that, and I recommend certain tests, like metabolic tests, like blood sugar levels and all those things. They can give you like a surrogate, and an estimate of your brain's energy levels, but the real tests are very high cost tests, probably aren't going to be covered by insurance. But just suffice to know that brain energy levels drop, and that makes you more prone to dementia, and so it becomes of first importance that we know how to maintain our brain energy levels, which is what brings us to what I refer to as dementia's dirty dozen. And I came up with this because I wanted to show people what all these different risk factors are. So does anybody see any commonality in this list of 12? June?
I'm sorry.
Do you see any pattern here? Do you see any commonality in this list? Come on, June, you know it right there. What letter do they all start with?
Oh, yes, oh.
The what now?
What you mean, what is it?
What letter do they all start with?
I-L?
I. You got it. I.
I.
So they all start with the letter I. What's going to say? So some of these, so like insults would be, I mentioned mold toxicity. It could be personal care products that we're exposed to. And women tend to put a lot more personal care. Dyes, relaxers, all the wonderful things you put on your hair to make you look great. Some of them are a little harmful. We put a lot of things on our skin. We take, yes ma'am?
Oh, no, I was.
Okay. All right.
Last week, they were giving out, just like what you had, just like the umbrella, and it had on there droopy eyelids.
Droopy eyelids?
Droopy eyelids on the dementia, because it was listing all of those that was up there, that you have up there, and everything, and it had droopy eyelids, and that's what the doctor said I had. But that's what was on the whole umbrella, it was understanding dementia.
Okay.
And that's what they had. They had just all the circles, just all those around dementia.
Yeah.
And then there's droopy eyelids.
Yeah,
I don't know the connection.
that's kind of strange. But what else? Does anything sound out to you on Mike here? Anything?
I mean, there are some things that you can control, I think.
Well, you control everything there. Almost.
Something else that is common.
I mean, what stands out to you? If nothing stands out to you.
Just, they're all negative.
Yeah.
Lifestyle.
Yeah, so some are lifestyle things. Yeah, inactivity, insufficiencies are referring to nutrients. So like I said, if you remember that picture of the arrows, the green arrows are the nutrients that build your brain, like omega-3s. So if you're not getting enough of the nutrients that are most important for your brain, you are at risk of dementia. because over time, the brain is struggling and it's just limping along. And then let's say something happens, some catastrophic event happens, like the loss of a loved one, that can tip you over. I mean, not you, anybody. You know what I'm saying? So this is like I like this because it gives you like a framework to think and find out where you are more or most vulnerable. And then hopefully you'll be able to make the right changes, adjustments in your life. All right?
Most of them related to food, what you eat.
What?
I said most of those related to what you eat.
Well, most of them are not. It's just, yeah, most of the insufficiencies are related to what you eat, but there are others that are not. But yeah, insufficiencies are related to what you eat. I don't want to reduce it to just food aspects. Okay, so isolation, we have isolation here. Nobody ever thought that isolation could actually affect your brain, but it does. They're now having studies that show that loneliness and other things can actually reduce your brain mass. So energy is very important. I give out in my talks, if you have a QR code, you can actually download the ebook, which explains this dirty dozen here. So I always make this available to my audience members. So what happens if your brain energy is reduced? I have this thing called brain farts. Oh yeah, so this is the network I was telling you about. The smallest, if you think about this, a nation is made up of families, right? The father, the mother, the kids, or the parents and the kid. I mean, one's not to be gender specific, so it could be two mothers, two fathers and all that, so I gotta be politically correct, right? But basically it's two neurons, two brain cells coming together and releasing a signaling chemical called a neurotransmitter. This has to happen, and it's happening per second, or millisecond, all over the brain. Everything your brain does, okay, almost everything has to do with these two cells coming together. One cell can come together with about 10,000, even 40,000 different other cells, and they're all exchanging information. As you're listening to me, your brain is changing. Your brain is not the same brain that it was when you walked in through that door because of the information you heard. You are comparing, you are making sense of the words I'm speaking and creating images from that. And maybe think about other things as well, but there's a volcano eruption of activity in your brain. And all that has to do with this, with what is going on in the network. And there are about 100 trillion, I don't know whoever got around to counting those, but there are about 100 trillion of these connections in the brain. Like I said earlier, that requires a lot of energy. And so that's where the problem lies. Because once you're not having enough energy to maintain your network and to perform the functions that we mentioned, you're going to be seeing problems. And that's why I have a list of these different things that can happen. Everything from memory loss to not being able to understand conversations, not being able to remember stuff, to being stressed, not being able to find your way home, for instance. I had someone call me, he listened to a lecture I spoke, I gave. He's like, he was so stressed about something, he could not find his way home to the home he's been going to for 20 years. All right? And all this has to do with brain energy. Okay? Sometimes, like I said, difficulty following a conversation. I mean, how many of you can relate to this? Asking the same question over and over and over again. All of this is as a result of reduced energy. And this happens, like I said, decades before your first symptom. Now, it's okay to forget from time to time where your keys are. But like Mike said, it's a different thing entirely if you don't know what those keys are for in the first place, right? So these are things, that's when we should be worried. And the problems first start in the parts. This makes sense now. The parts of the brain that require the most energy are the parts that have to do with the greatest amount of thinking and memory. Because that's where the greatest networks are. There's so many more networks in memory centers of the brain and other parts of the brain. Okay? So it makes sense, doesn't it? So that's why memory is one of the first things to go. Because it could require so much energy.
As I said, I treat dementia all the time. I have people in Nigeria and other parts of the world where I treat virtually. And we see these problems over and over and over again.
So let's talk about current treatments. Currently, there are some drugs that are out there, and their whole focus is to remove the plaques that develop in the brain as a result of dementia. Okay, so the whole focus, we're talking about billions of dollars going into treating dementia based on one thing, the amyloid plaques. Now, based on what you just heard from me, how effective do you think that's going to be?
To eliminate plaque,
Yeah.
I mean, that's, I mean, if they find something that can help clear it up, that'll be effective.
What do you think?
And you look at it,
Well, what if they do remove the plaques? What happens to the energy levels? If the plaques are removed, does that automatically mean that energy is restored?
Well, I don't know if energy would be restored, but like the neurotransmitters, the synapses wouldn't be blocked. Doesn't the plaque block the synapses?
That's the theory. But even if they did, this does not touch energy supply.
It doesn't, yeah, it require more energy to work around the plaques, or doesn't the plaque like stop? It's like,
so where does the amyloid, where does it hit first? What section, I mean, where's the build-up?
Good question. So yeah, around the memory centers and the other areas as well that I just mentioned, parts that have to do with thinking and all that.
So you still need the energy for the rest of the brain.
You still need energy for the rest of the brain. You still need energy for the rest of the brain. But more importantly for those memory centers as well, because they require energy. My point is this: removal of the plaques, even though, let's say it's perfect, does it perfectly, it removes all the plaques, it removes the hindrances from the synapses.
But how long is it gonna be due to black? That might go back the next
Correct.
year or something like that.
Correct, because part of what causes the plaque accumulation, part of what causes the plaque accumulation is that the brain lacks. So one of the functions of the brain is to remove plaques. It can only do this when it has enough energy to do that. And this usually happens at night. That's when the brain removes the plaque. That's why sleep is so important. It can only do that when it has enough energy. If it's lacking energy, it will not be able to remove the plaques. And so the plaques will accumulate. So that's why simply removing the plaques without restoring energy,
Enough energy.
without restoring enough energy, like you said, the plaques will just come back. And there are also, in addition to this problem, there are also complications that we're finding out with just removing the plaques. Those complications using these drugs, it includes brain swelling and brain bleeds, because they are tearing the plaques away from the brain cells. And when they tear the plaques away, it might cause bleeding. Does that make sense?
So you're sort of saying like, people who work all shifts and don't get enough sleep, they will be more prone to getting dementia down the road?
Correct.
They will be more prone.
Correct. That's why one of the risk factors in the dirty dozen, if you recall, is insomnia.
So why are they saying something? One of the things, okay, they should be trying to do.
All right, so that is.
Inform these people or whatever.
They should be, yeah. So,
Like I mentioned, I treat dementia as well, so our approach is a holistic approach where we address several things at once. Number one, obviously, is to restore energy. We also got to restore blood flow, because blood is what brings the energy to the brain. We've got to restore the blood flow. In many cases of dementia, many people have problems with their blood vessels, so they're not getting enough blood flow. They're not getting enough nutrients and blood to the brains.
So what's the number one thing to increase, but other than food, nutrients, what exercise?
Well, exercise helps.
Exercise.
Exercise helps. But so there are some targeted nutrients that we use. There's an amino acid called L-arginine. Ever heard of that before? Heard of L-arginine? You heard about it probably from the bodybuilders and all that. Where did you hear about it from?
Well, for muscle and fitness, and don't know if it's one of the supplements I was prescribed, but I'll go when I get home.
No, that's omega 3. That's omega 3. L-arginine is an amino acid that converts when the body takes it, it converts to a gas called nitric oxide, which opens up the blood vessels and improves blood flow. Nitric oxide. Never heard of that before. Have you?
Yeah.
Okay. Nitric oxide is very important for brain function and blood flow.
Omega 3,
No, that's what we're talking about. No. That's different. So yeah, you need omega 3s for brain support, yes, but blood flow is different. I mean, it also helps with blood flow. It helps make the blood vessels and the heart healthier, omega 3s too. But when you're talking about improving blood flow,
I was gonna say, that's what we look at. Now, I was gonna say, atherosclerosis.
yes.
Forming blood clots or strokes, that's
Yeah.
all involved in that too?
Yes, yes. So L-arginine can really help in all those atherosclerosis and so forth. So like I said, I'm not going to go through everything, but really to address dementia, you got to have a multi-pronged approach. And so I have several testimonials of patients who are improved based on our treatments. I remember I had to create this over years and years and years of just working with kids and working with adults. I'm working, there's a patient in Nigeria now. She was in really bad shape. They sent me her results. MRI scans show severe atrophy, which is shriveling of the brain, like we showed you earlier. And I wasn't really so sure we were going to get some good results, but lo and behold, as soon as I bought the things, I sent them back to Nigeria and I gave the caregiver the instructions on how to do it. So this is just over a month now. She is back walking around. They sent me a video of her recognizing and calling her grandchildren by name, and she couldn't do this before. She was bedbound. They had to feed her. Now she's feeding herself. And
How long is this process to drain the brain and so forth?
the results we got within a week. Now the walking took a little longer, but they were seeing results within a week.
What?
It shouldn't take that long. Now remember, I have a background with working with kids where if I didn't get results within 2 weeks, they wouldn't come back. We needed them to come back. So we had to figure out how to get them to get results quickly. Now having said that, children respond a lot faster than adults do. But still, if I'm not getting results in 2 weeks, I'm doing something wrong. Now they say you have to have 3 months before you see the first results. To me, that's insane. That makes no sense to me. If you're doing the right thing, you should get results within a week, at most. I give it 2 weeks just because, well, maybe they're still trying to figure things out, or maybe it's a very tough case and we're trying to get the right combination. But you should be seeing results within a week.
these are some of the things that were going on. She had vascular dementia. She had, I'm just reading this from her medical report. Global cerebral cortical atrophy. Anytime you see atrophy and the brain in the same sentence, that's not good. That's really bad. And like I said, we got results. So let's end this up. There are going to be new dementia cases every year. The numbers are getting worse and worse. It's going to be worse, even 3 times as bad amongst Black Americans. And I try to reach the Black community. June, I try to get into churches and all that. They are not as interested. I'm just not seeing response. The biggest responses I've been seeing among the white community. And I'm more than happy to work with the white community, but the Black churches, I feel, need us more, and they are not interested. Can you explain that?
And it's so prevalent, though, and
It's very prevalent.
you know, they would.
Yeah. Anyway, so it's prevalent among the veterans. So these 3 groups of people have it twice as bad as the rest of the population. Veterans, Blacks, and women. The 3 areas that I feel the most focus should be on. Not to say white people are important, Mike, right? But we're all important. But we need to focus on these things. Anyway, so let me just wrap it up there. Like I said earlier, we need to find a way to make it simple, make it clear, make it practical. So I always use this framework. Think of your brain as a fortress, a castle. You have the population living within the building, within the fortress, doing whatever they're doing, economic activities, farming, political, reproduction, that's important too. And then there's a moat to protect it, and then you've got the walls and all that. So think of your brain that way. It's constantly being affected by the good and the bad. So what we want to do is, okay, let me go back. People who have dementia, like we said earlier, have more of the bad and then less of the good. What we want to do is that we want to turn that around. So you want to reduce the attacks and increase the protections. And this is something you got to do deliberately. It's not going to come easily. It's not going to come as you go about your daily activities. It's something you have to plan for, something you want to do deliberately. Some of the things, I'm going to mention some of the things that you need to do. So to reduce the attacks, you've got to reduce your sugar. That's probably number 1. That's probably our greatest weakness, especially Black people. We like sugar more than white people do. We take a lot more sugar. I've noticed that. Can you see this? It's a teaspoon. This is what your body is comfortable with, amount of sugar, right? After you've eaten a meal, 2-3 hours afterwards, it brings it down to the level of a teaspoon.
If you don't have copper, the manufacturers don't care.
Well,
Manufacturers.
they're targeting you. Not that they don't care. They're using this against you. So sodas, we like sodas. So everything from sodas to starchy foods. It doesn't have to be sweet, by the way. There's so many things that have a lot of sugar, or the body converts to a lot of sugar that are not sweet.
And they just create more and more day by day.
Yep. So you want to reduce your sugar, you want to strengthen your defenses. And one of the things that I recommend, as we talked earlier, there's a study that the Alzheimer's Association did not too long ago. And they found out that you can reduce your risk of dementia by 40% if your blood levels of vitamin D are adequate. So
And
that's
adequate, what's the adequate number? Because some people saying 60, some say 90. So what D3?
so this is the range. This is the range right here.
Okay, so the higher the better.
Correct. I would say the closer to 100 you are, the better. Yeah. All right. So I have a QR code here where I let people. It takes them to all this, everything we've talked about. there's a web page on my site that brings the research and the scientific evidence behind what I'm just talking about. Okay? So bottom line, if there's anything you can remember from, you want to get the QR code?
Yeah.
You know, you have a
Oh, that's
smartphone.
okay. It's just Brain and Body Foundation, that's what you,
No, it's on this. You're not going to find this on the Brain and Body Foundation. This is a specific web page.
Okay, got it, thank you.
Okay. All right. So if you don't remember anything, just remember this: energy levels are what matter. So you want to increase your energy levels. You want to go from low energy levels to high energy levels. Hopefully, we've been able to talk about some of the things that can help you do that. Yes. Okay. So here's what I say: we need your help. I feel this is something that we need to get out to as many organizations as possible. So if you have any ideas or pointers for me, I would really appreciate that. With that,
Thank you.
concluded.
Thank you very much.
Well, thank you for having me.
Thank you for being here.
Absolutely.
how do you feel about the millennials and Gen Z? Are they interested in health? Or they just think to sell this like crazy? I mean,
Yeah, that's a problem. I mean, they can handle it now and don't have to worry about these things until they have to worry about them. So, but I say let's focus on the people that really need it right now. The millennials, the Gen Zs,
I mean, I can speak for Gen X, being a member of that. I know a lot of my peers there's a trend in people not drinking alcohol anymore. And that's a huge, like, healthy, that's a physical and brain health choice.
yeah, good. Good. I mean, probably they're reducing it. Yeah, that'll be a good way to go.
Hopefully,
Yeah, yeah, yeah. But people need to. So it's one thing to know what to stop doing. It's another thing entirely to know what to start doing. And
yeah, what you said about vitamin D, taking it every day instead of once a week.
Yeah.
Prescribed,
Yeah.
that makes more sense.
yeah,
the doctor don't feel,
I have.
that's another.
I have people who they had sleep problems, and only when I started asking them to take vitamin D every night, and the sleep problems resolved.
Really?
So you,
It helps you sleep.
at night,
Yeah, yeah. I recommend twice a day, morning and evening. But it helps you sleep. Yeah. That's another thing you didn't know, right?
No, I mean, there are certain medications that it will say take at night, but then there were some, I was filling up my pill thing, and some of the supplements that I take, you know, some are for energy, so I know take that in the morning, and some for relaxation, so I know take that at sleep just to help calm down or whatever. But some of them I had to look up because it didn't say one way or the other.
Yeah. Yeah. Some don't matter, but some people will say, oh, you got to do it in the morning for vitamin D. It doesn't really matter. But if you really want to help, if you want to get help.